Before we jump into this episode, I want to remind you that while Caitlin and Sophia are dietitians, we're not your dietitians. This means the information shared in the Food Freedom Fertility podcast is intended to entertain, educate, and inform. It is not a substitute for medical care. This information is not intended to diagnose, manage, or treat disease. Always consult with your doctor before making any changes. Welcome to Connection Corner. This is where we read the ratings and reviews that you have left us. So this one comes from That's literally the name that they used on here to give us a rating and review. And this is a 5-star review that says, easy and informational listening. Caitlin and Sophia make following directions easy and fun. I think my children would disagree with you there, but all right. I enjoy their banter and their passionate wisdom shared with us as listeners. I always recommend their show to people who share with me that they're trying to conceive. Awesome. Thank you so much. And listener, I encourage you to go give us a rating and review right now because maybe on the next episode, yours will be the one we're reading back to you.
Welcome to another episode of Food, Freedom, and Fertility. It is Sophia and Caitlin, your dietitian besties, hanging out with you in the fertility and nutrition space once again. And it's really fun to look at Sophia today because in real life tomorrow, I'm going to be looking at Sophia.
You
In real
just revealed
life.
the yeah girl.
You have to have another one. Early yeah girl. We're going to see each other tomorrow, which is so fun. It's been a while.
Yeah, when was the last time you and I were in
Was it
person
a year
together?
ago? I think it was a year
Was it
ago
when
in
we went to New
Colorado.
Orleans?
No, we went to
Have we
New
seen
Orleans
it?
before Colorado. I think
Yes, it
a
was when we went
year,
to Colorado together a year ago.
which is wild. I'm bringing bubbles because this is what I'm going to celebrate at the end of the thing, but we have things to celebrate. So,
Oh, like champagne bubbles?
champagne bubbles.
See, to me, I'm thinking like dip and blow.
As our two
Like,
4-year-old, 5-year-old, 3-year-old,
yeah,
and
I was like,
7-year-old get
oh,
together.
they'll love that.
Hey, let's do that. It will be bubble time for everyone. Age appropriate. Everyone gets
Everyone get
bubbles.
bubbles.
Yes. Well, Sophia and I also need reasons to laugh today. So we're going to get into it. And this is going to be hopefully kind of a split episode where we're going to let Sophia do a little bit of a reveal on some experimental therapy she's going to be trying to help her fibroid. And I'm going to chit chat a little bit about ovulation induction and PCOS, like a little bit of in-depthness on your options and just some interesting things I've seen in practice lately with a couple clients. And I think it will help direct you in having conversations with your providers if that's something that is a next step in the road for you. So that's what we're going to cover today. I say we start off with your update, Soph.
Okay. So starting off, guys, I'm going to bring you through sort of the progression of this fibroid. We've talked about it in bits and pieces in many different episodes, but we haven't sat down and like told the whole story from start to finish. So here is the quick 5-minute elevator pitch of what is happening. So rewind time back to when I was a pubescent girl. I started having acne and painful periods. And so my mom took me to the pediatrician and they put me on birth control pills, which
Can we
back
just
in.
pause there? Like, it is weird to hear the sentence pediatrician and birth control pills in this scenario. Like, that should
It
be
was
a
weird.
tip
And they
off.
made me do a vaginal exam to do it. And I remember I had my underwear like inside out or something, and they were like, "Oh, your underwear," because they were like, "You could just pull them down. You don't have to take them like all the way off." And just to, I think he wanted to see like, is this
Are
really
you
like a
growing?
pubescent
Yeah.
girl? Like,
Uh-huh.
are we sure that this isn't? There are different variations of genetic things, and some people have different things going on, and
Mhm.
he wanted to do a way of just checking and make sure things really were
Yeah.
progressing. And so it was a man too, which was so weird for me.
Yeah. I
But
just think
anyway,
that's weird. Like, the sentence should go, we went off birth control, we had a baby and took her to the pediatrician, not I was like 14 and
not
went to
even,
the
I was 12.
pediatrician. I was 12 and went to the pediatrician and got birth control. Like, that just to me, that is If that does not blow your mind, it should. That's just
Mhm.
wild to me that that was the solution
Yeah,
he
it was
could
like
could
the summer
follow.
before I went to 8th grade. Or maybe it was the summer before I went to ninth grade. Maybe I was 13. Whatever, young. And so, anyway, I started taking these pills. It made me spot for like a whole cycle. Like I just had like a light day period thing going on every single day for a whole cycle. And so then we had to go back to the doctor and say, what the hell? And so then I had to get a ultrasound. And so they did a pelvic ultrasound on me, and that's when this fibroid was discovered. So
Mhm.
was the fibroid there, or did going on birth control pills give me a fibroid? We can't really be sure, chicken or the egg scenario here. But fast forward 25 years, we see now that what was really going on was a fibroid and endometriosis. This is why, whether the fibroid was there or not, but I had endometriosis, and that's what was causing a lot of issues. Meanwhile, I'm also getting treatments for irritable bowel syndrome and all these things when really it's endometriosis. So, I go through my life knowing I have this little fibroid. I think at the time they told me it was like the size of like a grape or a blueberry. It was just this little bitty thing. And I really didn't think much of it until I was getting ready to get married, and I was working at a clinic that I'm actually working with again now. And I'll talk about that as part of my story here. But I was working at this place called Joy Wellness Partners, wonderful clinic. And me being just the curious person I am, I wanted to try everything. And so many of my friends were using their like testosterone pellets, and they were like lifting and getting super skinny and just like feeling amazing all the time. And so I was like, hell yeah, juice me up with that too. And I felt okay, I guess. But then, like, one day, I like just this almost like a period cramp on my right side that just wouldn't quit. And it was so weird. And like, I would, even when I was like walking down the street, like the impact of my foot hitting the concrete was making like a pain on in like the lower right side of my belly. So I was like, what is this? So I go get an ultrasound, and they're like, "Oh, you have a huge ovarian cyst." It was the size of a baseball. It was enormous. And you have a fibroid. And I was like, "Oh, the fibroid, what does that mean?" And the sonographer was like, "It just means that you are a woman." Like these things are so common, and they come and they go and they grow and they shrink, and they just sort of are. And there's really no pathology here. There's not like making you sick. It's just a thing. So, anyway, I stopped using the testosterone supplements. Everything's fine. Move on, move on, move on. No more fibroid issues to note until I'm pregnant with my first baby. And at the beginning of my second trimester, I start having such severe abdominal pain. And it's like my whole uterus is like Charlie horsing. It just hurt so much. And it was like rhythmic, it would like come for like a minute and then not for 5 minutes. And anyway, so after a couple days of this, it was just getting so bad. I was really worried that something was wrong. And so I went to the hospital, and they told me, you're in labor and you're just going to have your baby and she's going to die. And I was horrified and so sad. I mean, if you guys want to hear what happened in our fertility journey to get pregnant, like it was a long road to get there. And this is a baby in my second trimester. I'm feeling her kick. I love her so much. I don't, the thought of losing her was just the worst thing that could happen to me. And those of you that have lost babies, you know exactly what I'm talking about. It is the worst thing that can happen to you. And so um, I was like, well, what can we do? And they basically said, nothing. We can't do anything. What we can offer you is Pitocin and Cervidil to basically make labor go faster so that she could be born and die. And then you can just, move on and get pregnant again and have another baby sooner. So you don't have to wait this out. Who knows when she's going to be born. And I was like, absolutely fucking not. I'm sorry. No, no way. There's got to be something else we can do. And the doctors were really pissed at me because I was planning a home birth. And so that's when they offered this to me, is when they found out I was planning a home birth. They told me how irresponsible and inappropriate that is, and such and so forth. And then told me, well, we can basically do, like, I don't know, assisted euthanasia of your baby. And I was not interested in this. And so they were like, well, I guess we can try this other thing, which is like a muscle relaxer for your uterus. So I tried that and it helped a little bit. But so then they were like, well, there's nothing we can do for you. Go home. So I go home, and my midwives, because this was all in like the middle of the night and in the light of day, they were like, what? Because they were like, yeah, go to the hospital and make sure. Because I was like, do I have a kidney infection or something? Like, that's what I thought
Right.
might be going
Or
on. And
cholecystitis or something,
yeah, exactly. Like,
yeah.
I thought I had like an infection. Like, it felt like that sort of thing. And so they were like, okay, go to the ER and see, what's going on. They did like a dip test on me, but they'd sent out like the culture, but they have to like send it out to a lab and all that. And they're like, well, if you need treatment right now because it's really this painful, go to the ER. They'll do that. They expedite all the labs and everything. So I come home and they are like, what? No, 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 to what those doctors said. This is crazy. So they're like, all right, we're going to do some herbs, acupuncture, blah, blah, blah. Fast forward, turns out what had happened really was that this fibroid of mine had gotten so big in the first trimester. Because in the first trimester, your uterus grows. In the second and third, it stretches. So it's like, the muscles getting like thick and big versus like stretching in the second and third trimesters. Hey, Food Freedom and Fertility family, it's Sophia introducing Fertility Cloud. High treatment costs can be daunting, but here's some good news. 80% of Fertility Cloud patients have gotten pregnant for under $2,000 after just 5 months of treatment. Starting your family doesn't need to come with a huge price tag. Fertility Cloud virtual consultations mean you can talk to them from the comfort of your couch. They create personalized plans for men and women, whether it's ovarian stimulation with Clomid or Letrozole, Ovidrel trigger shots, guidance on male fertility, or even weight management support with medication. As a special for Food Freedom and Fertility listeners, get $50 off your initial medical doctor consultation. With meds delivered in just a day or two, unlimited support for your questions, and free follow ups when needed, they're here to make your path to parenthood smoother and more affordable. Ready to start? Visit myfertilitycloud.com and enter Food Freedom, one word, at checkout. So the fibroid had grown really big right along with the uterus. But then when it came time to stretch, it's this fibrotic tissue. It's not muscle the way that your uterus is. It can't stretch the same way. So the uterus is stretching around it, essentially like breaking off its blood supply. And so this is something called red degeneration. It's called red degeneration because it's like there's bleeding involved. And it's extremely painful. It is in no way harmful to the baby or to you. It is not associated with preterm birth or anything. It just hurts like a bastard. And you have to just wait it out because you're pregnant. You can't go just take a bunch of pain pills. So
Mhm.
we learned that that's what was really going on. The midwives were like, once they got a bearing on the situation, because when I had seen them before, I came in saying, I think I've got a bladder infection. And so they tested me for that, and it wasn't that. And then within a few hours, it became, this other thing. So then once they sort of had their finger on the pulse of what was going on, they were like, no, 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 this is a fibroid. So they gave me herbs and acupuncture and all these things, and it took like a month. I was in bed for like a month with this thing,
Oh
but
my
it
god.
all resolved, and I had a freaking new lease on life. I was so happy to be alive, so happy my baby was alive, like amazing. So fast forward to now, it's time to birth this baby. Um, and I birth her. Hooray, she's healthy, I'm healthy, all the good things. But once your uterus pushes the baby out, it immediately starts shrinking really quickly. It goes through this big change where like the placenta detaches and all the blood vessels in your uterus start to like shrink up. Well, there's this big fibroid off the side of my uterus. So my uterus is shrinking and the fibroid is like wilting, almost like I don't know if when you see those bounce houses like deflate and there's like
Mhm.
a big
Mhm.
turret for like a castle and it's staying strong, but the rest of it's
Mhm.
folded. Anyway, you get what I'm talking about. That's sort of what the fibroid was doing. So the placenta couldn't really get all the way out because the membranes that surrounded the baby had broken, right? And she'd come out. But some of them were sort of trailing, and the fibroid had made like a fold in my uterus, and the membranes were like stuck in the fold.
Mhm.
So my midwife, she was like, this isn't a retained placenta because your placenta is like halfway hanging out of your cervix, but it can't come out the rest of the way because these membranes are like trailing. So she had to like glove up and go in there and like push and pull and everything to get it to release because this fibroid was causing a problem. And so I ended up being fine. I needed they used like body work and herbs and stuff. And thank God I was at home because if I'd been in the hospital, immediate trip to the ER, tons of drugs, they would have nuked me if I was there. Whereas at home, it was like some herbs and body work, which was honestly, sounds kind of nice, almost a spa treatment,
Mhm.
right? So, now, in my second pregnancy, no problems with the fibroid, except it was hilariously big. It looked like a doorknob poking out of my body. And you know what? We could post a picture of this if you guys want to see it because it was so funny. It was so big. And like when I would have like a Braxton Hicks contraction, it would just be this like ball poking out of my belly. It was like an alien. It was so funny.
Mm.
But no problems in my pregnancy, none at all.
Hallelujah.
Once I birthed my baby, though, there were some problems. Her cord was super, super short. Again, praise to home birth. If I'd have been in the hospital, they would have really messed me up. They either would have just demanded a C section, or if they didn't know the cord was short, they would have broken the bag and given me Pitocin, and it would have put so much traction on the short cord, it would have either suffocated her or broke it open. It would have been really bad. So, letting birth progress naturally, no artificial rupture of membranes or anything like that was absolutely the best thing for her and for me. But the position I was in when she was born, I was like up on my knees, like sort of like a prayer pose. And so she came out and gravity pulled her, but the cord was so short, she couldn't descend all the way. And so it like pulled on the placenta, which made me start to hemorrhage. And that's all well and good and fine, except my uterus couldn't clamp down the way that it usually does after birth because this damn fibroid is like flopping around and they're like so big and not functioning the way a uterus would function because it's just this big stupid ball that doesn't do anything. And so I had a hemorrhage, which was it was managed at home. Again, thank God, because if I'd have been in the hospital, they would have put me on every drug on the planet and done all kinds of crap to me, and maybe even tried to give me a hysterectomy or something because this fibroid is causing a problem. They would try to just cut it out. It would have been bad. But thankfully, I was at home, so they just again body work and herbs and nutrition. Shout out to nutrition. I didn't go into shock with all that blood loss because I have such great nutrition. And muscle mass, ladies, again, plug, build your muscles. They will protect you in a hemorrhage. So I couldn't recover, like my uterus couldn't clamp down the way it needed to because of the fibroid. And the three strikes you're out to this fibroid came this past January when I had an ectopic pregnancy that was outright caused by the fibroid. This fibroid had gotten big and put some pressure on my uterine tube or fallopian tube, depending on how you pronounce it, and basically made it to where a sperm could get up the tube, but a baby couldn't get out of the tube. The baby is much bigger than the sperm and couldn't get out. And so got stuck in my tube, implanted slash whatever, like on my ovary slash inside my tube, and ended up causing a rupture again with the hemorrhage. And I had to have, not only did I lose that baby, which is the saddest part, but I had to have another freaking surgery to resolve the ectopic pregnancy, and I lost a ton of blood, and it was just a real bummer time. So here we are. I'm 37 years old. I'm going to turn 38 in about a month. and I have some choices to make. I have already done a radiofrequency embolization, which is where a doctor goes into your uterus surgically with some little zappers and zaps, basically cauterizes the blood sources that are feeding the fibroid. And
And
that was a failure
that
a
happened
year ago.
with her endometriosis surgery
Yes.
prior to this pregnancy loss, and
Yes.
so, there was, like, an attempt, a proactive attempt after your second baby to manage your endo and manage this
Yes.
fibroid in a way that
Yes.
would allow you to still consider another pregnancy, potentially a
Good point.
birth outside
Mhm.
of a
Outside of the
C-section.
hospital. Yeah.
So, it's not like you were just sitting on your laurels, like, come
No,
what
far from
may.
it.
Yeah, you were
Far
very
from
much
it.
trying to manage this thing, and so
Yeah,
I
super
just wanna
trying
bring that
to.
up because, like, I think a lot of people, once we get to what your next treatment attempt is, are gonna be like, "Sophia, really?"
Oh,
But,
yeah. Oh,
uh
yeah, really.
yeah, but I think it's important to also hear, like, that I say we, like I've had any part of this. Sophia has very effectively tried to do what is evidence-based, has not shied
Mhm.
away from medicine or surgery or herbs or acupuncture or all the
Dude, I've
things.
done it all. I've thrown the book at this stupid fibroid, and I've been calling her my frenemy this whole time.
Mhm,
And the surgeon who did the surgery, she's like, "Well, she's just an enemy now." Like, whatever, you're supposed to love yourself, but this one doesn't seem to love me back.
yeah,
So, yes, exactly. I've done all of this crap: acupuncture, herbs, pelvic floor physical therapy. I
nutrition.
have nutrition, supplements, radio frequency embolization, all these things. And the next step is try to get pregnant again with this fibroid or try some other freaky shit to try to get
Or
rid of it.
Or remove it with the potential to remove your chance of pregnancy, right?
Yeah, because the way the fibroid, I mean, actually, well, let's talk about it. So, the fibroid, we've been looking at it through ultrasound all this time. How big is it? How deep is it? Like, which layers of what is it going into? And all these kinds of things. And with the ultrasound, the prediction is that they're going to have to cut a hole clean through the uterus, like a football shaped hole, to get this fibroid out, which is different than a C-section. A C-section is where you just cut a line into the uterus versus pulling a chunk out of it. So think of like I got a cut and needed stitches versus like they removed a mole and now I need stitches. There's like a chunk missing. So that's really what the fibroid removal would do if I was to get it excised. And due to the size of it, they were unsure of whether they could do this laparoscopically because you got to get this big honkin' chunker out of my body. And can you do that through a little surgery hole, this big?
Mhm,
Probably not. This is like a 1 centimeter hole. So what do you do when the fibroid is like, you know, eight,
mhm.
6 centimeters? It can't go through there. So we just had some choices to come up with. And I didn't like the idea of surgery for a few reasons. One, surgery sucks. Recovery sucks. And I've already had 2 abdominal surgeries. Your peritoneum, your abdominal cavity is fragile. And the more you cut into it and mess with it, the more potential for complication and the more severe those complications become. So, in the surgical world, they really say you can only have about 3 abdominal surgeries before you just stop being a candidate for them. Like, the tissues start breaking down, you start having all these herniations, and then now we're needing to put in like hernia mesh, which causes even more problems. And it's like when you have vowed to do no harm, a non-life threatening surgery that would cause potentially that much issue, are we really not doing harm? So this would be my third abdominal surgery, so I would be right on the edge. And this is also why doctors are like, well, if you're going to have C-sections, you need to limit the amount of children that you're going to have, because we can only cut into you so many times before it starts being all these risks and complications I just said. Now, have women gone on to have, 4 or 5 children all via C-section? Of course. But is that what's like recommended? Not at
No.
all.
Mhm.
So here we are looking down the barrel of a third surgery. And I just, and then the other risk of it is having to cut into your uterus like that. You're really risking losing the uterus altogether.
Mhm.
Uh, and that would just be such a devastation to go in there thinking you're improving your fertility and to wake up
With
and
no
they
uterus.
say, you've lost your organ. You cannot have any more children. It's not physically possible. That would be awful. And I don't want to do that. So I'm putting that off. I mean, I hope to never ever need it, but I certainly am not going to choose it at this juncture if there's any other option. And so here we are, right? That brings us up to present day. With all of this stuff, I had some choices to make. And so I decided, let's get weird with it. Let's try a bunch of stuff. So I had my doctor write up an order for an MRI so that we can get a really good look at the fibroid, a MRI with contrast. So this is like gold standard, closest thing to x-ray goggles we can get is this contrast MRI.
Mhm.
And so that's where we are. So I went and got this MRI, which is the gold standard of imaging, to see not only the size of the fibroid, but the depth. How far into my uterus is this going? How, would we really have to cut all the way in? And
Mhm.
the answer looks like probably not. It's more in sort of the outer muscle layers of the uterus and not in like the endometrium where a baby would be. So it's looking more like removing a mole off your skin than like removing a, big piece of your bone or something like that. Like
Okay.
less of a invasive procedure. It would still be a full-on anesthesia abdominal surgery, and they may have to open me more depending on, how to pull this big old golf ball out. But it's a little more hopeful
Mhm.
now that we see the size of it, which is it's about like 4 centimeters by 3 centimeters. So sort of like an egg shape, not perfectly round like a golf ball, but
Mhm.
yeah, like the shape of an egg, the size of an egg, maybe like a small egg, like if you get, not the jumbos, but like the
Mhm.
small.
Mhm.
That's sort of the size of it. And so that was encouraging to see that it's not so deep. It's also not in the endometrium, which means it's very unlikely that it would impact my ability to become pregnant, which we've seen evidenced by the 3 pregnancies that I've had.
Mhm.
So that's encouraging as well. So it seems like it's a very real possibility that I can get pregnant again with this fibroid. Um, so that's great, but I really want to shrink it down more before I try to do that. So here is what I'm trying to shrink my fibroid more, and I will tell you all the details when we get back from this break.
Hey, friends, we're taking a break from this episode so I can share with you a little more about one of our sponsors, Fullwell. Fullwell's a reproductive health company offering superior nutritional supplements that are made without compromise to support women and men throughout their reproductive journey. I have taken Fullwell's prenatals, their fish oil, and have literally tried every product they've released, and I stand behind this recommendation with my whole heart. One of my favorite things to recommend to clients is their fertility trio. This includes their egg and sperm quality supplement, their women's prenatal, and fish oil. This helps proactively support you getting ready to conceive. This trio includes things like CoQ10, ashwagandha, and NAC. It makes me think of a life vest. You don't want to go into pregnancy without these foundational supports. And if you've been struggling while trying to conceive, this is the time to upgrade your prenatal fertility game and check out Fullwell. Use code FFF20 today to get 20% off your first order.
I am partnering again with Joy Wellness Partners. They are a regenerative wellness clinic here in San Diego, and they also have a location in Utah. So, if you are located in either of those two states, they can work with you via telemedicine. Or, if you're in San Diego or the Southern California area, or I don't remember where in Utah their office is. So, sorry about that. But we're going to have Carol, the founder, on here to talk about all of this. But I talked with my surgeon, and when we were talking about non surgical options of what I could do, first line is a drug called Lupron, which sucks a big one. Okay. That is a major hormone suppression drug that is going to severely and immediately put me into menopause, like from the first dose. It basically shuts your ovaries all the way down, turns off your hypothalamus, your pituitary, just shuts it all off. So there's like no hormone circulating. This is used in like estrogen responsive or hormone responsive cancer treatment. It's also used a lot in IVF for women with endometriosis. They give you this to try to like shut down all of the hormones that signal to your endometriosis to grow or respond to the IVF drugs. It's a hellacious experience to go immediately into menopause like that. And we're talking not just the physical symptoms, which are very real, but the emotional and cognitive symptoms. And I don't want to do that. I mean, I understand why some people choose to do that. And life threatening situations are very real, but I don't feel that I'm really in that category. And so I did not want to use that drug. And her next suggestion really surprised me, but it was a GLP-1 agonist. So, if you want to learn more about those, Caitlin and I did sort of a Ozempic, Mounjaro, Wegovy, Zepbound like review episode a couple episodes back. And so she said that she in her practice, she doesn't have like big literature to back this up, but in her practice, the gals that are using these drugs are doing fantastic. That their endometriosis is way less, that fibroids are shrinking. And basically, the thought behind this is that just as fat is estrogenic and insulin responsive, as are these tumors in endometriosis tissue as well. But this is essentially a benign tumor. That's what a fibroid is. And the way that it responds to estrogen, which is, when I went on this estrogen medication, is where we saw this thing for the very first time. And then the intense amount of estrogen and testosterone that you have when you're pregnant, this thing got enormous. And then when I was on the testosterone meds before, it got really big. It's very responsive to these hormones. And so being on a GLP-1 agonist, I got to say, I don't fully understand the mechanism of how this impacts these hormone sensitive tissues, but it seems to. And so she recommended I start a really small dose of tirzepatide. And tirzepatide that's what's in Zepbound. It's a GLP-1 agonist that's not FDA approved for like diabetes management the same way that semaglutide is. Tirzepatide is just more for, I don't know, appetite suppression, I would say. But it has all these sort of side benefits if you take it in for the right, in the right way and with the right dosage and these kinds of things. So I was just shocked. I walked away from that doctor's appointment. I didn't know what the hell to think about anything. I was bewildered. But the more I thought about it, the more I was like, I would be willing to give this a go. First of all, I'm just really interested in trying things. I'm just a naturally very curious person. And so I've been like this with everything like, oh, the Dutch test, got to do one of those on myself. Oh, the GI map, got to do one of those on myself. Like I was the person that was so pumped for this MRI and like couldn't wait to experience, what it was all going to be and meet all the people and ask him 100 questions and get all my results. And like, I'm just, I'm in this field for a reason. I love this shit. So I was just pumped to try something new and see what this is like. So she was like, here's the thing though, are these drugs are not cheap and insurance, there's no way they're going to approve this because this is like so off
So off
label.
label. Yeah.
Yeah. Like barely anyone's even doing this. There's like a few, the research that you can find on it is first of all done in obese populations, which I don't fit into. And then secondly, most of it is like review or like perspective, like based on the findings we've seen from these other things, we think that it would be really effective for these other things too. And so
Mhm.
that's sort of what's out there. Um, and then the other thing is the dosage. So, for someone who is using these drugs for diabetes management, for weight loss, we are looking at quite a bit of the drug. You're using kind of a lot. Like you're going to be using 50, 75 milligrams, like a lot. Whereas I'm on 5 milligrams. So the therapeutic dose, usually you start someone around 50 and then you'll continue to titrate it up until you're about at like 100. And that's what they're going to do for someone who's using
Using it
this
for
like
a different.
on label.
Yeah.
Yeah, like
Mhm.
the intended studied use. I'm on 5 milligrams, slowly titrating up to 8 milligrams, maybe 10, depending on how responsive I am to this. Um, so it's a really small dose, and I have been on it for 1 week. And I'm mixing it with another drug. So I've got another drug called thymosin alpha. And thymosin alpha is a peptide, just like tirzepatide is. But this one is something that's naturally occurring in your thymus, which is a gland sort of near your heart that is big and productive when you're a child, but then really shrinks away and becomes sort of non existent as you age. And it is in charge of immune modulation. So, the kinds of immune cells you're making, what they do and what they don't do, that's a lot of what your thymus does. And this, again, is highly regulated by hormones. So if your cortisol is high or low, your insulin is high or low, it really impacts how your thymus regulates these immune cells. So thymosin alpha is a naturally occurring, there's a synthetic version that's been used in like hepatitis treatments, different cancers, things like that. This is the like naturally derived compounded one that I'm using. And it is to modulate my immune system, but it's really effective against tumors, which is what this fibroid is. So I am using 5 milligrams of tirzepatide. Actually, today I'm going to use 6 milligrams because I'm titrating it up,
Mhm.
and 50 milligrams of thymosin alpha twice a week.
That's amazing.
And I actually have them right here, and it is time for my dose. So you guys can watch on YouTube what it's like to actually use this drug, and I can give you guys a demonstration.
Let's do it.
Let's
Show
yeah
us.
yeah. So why don't you ask me some questions too while I do this? So
So,
watch out, world. Here's my belly.
so glucagon like peptides, that's what we're doing right now, not the other
I've got
thymosin.
them both. I'm going to do
Oh,
a dose
are
of
they
each.
both injections?
They're both injections. Yeah,
Are they going into fat or muscle
they go.
primarily?
Well, take a look here. What do you think? It
Mhm.
goes into your fat. You basically pinch an inch off your waist, your belly, and stick it in there. You probably could do like a hip or a butt too, but I don't know. This is
People
my
tend,
fattiest
I
area.
mean, people who are on Ozempic or tirzepatide, they tend to like rotate spots. But I would think with a smaller dose, it might be nice to get closer to the actual intended target. That would be my guess.
So those of
Okay.
you who are needle phobes, the needle is so small I truly don't even feel it going in.
So it's probably like a insulin,
It is, yeah, it's an insulin
insulin
needle, really
syringe.
small. So you shake it up and then you draw out in air the amount that you want to put in your belly. So let's see, 6 milligrams. And then you poke it in, boop, squirt in your air, tilt it up, and suck out the amount that you want to use. There we go.
So she cleans an area with a little alcohol swab. That's just like a precaution to make sure you're not injecting bacteria or whatever's on your skin or what could be on the needle because it's not completely
Mm-hmm.
sterile. And then pinches, injects, and then there you go. No screams
And
or
then we do the
shouts
same
of
thing with the
pain.
thymosin alpha, except this one sucks a little more because I do 50 milligrams of this,
Oh, yeah.
which is like quite a lot. So it's like basically the whole syringe. And it just hurts a little more because it's like you're pushing quite a volume into your body. It's just like
So
kind of
while
a
we were
lot of.
talking, I Googled a few things and saw kind of a small observational study that was published in the Journal of Clinical Endocrinology and Metabolism in 2023. And in it, they noted a reduction in uterine volume in some women with fibroids who were taking glucagon like receptor 1 or peptide 1 receptor agonist. That's a really big mouthful to just say GLP 1s. That's why people are saying it that way. Like Ozempic semaglutide or like tirzepatide, like Sophia's taking. This was like a small, again, as Sophia said earlier, observational. We're like at the beginning of looking at this for this. And so we don't have these huge randomly controlled trials. But in the context of what we were talking about earlier, you can see if you're watching on YouTube the amount of intervention that's going on right now as she injects herself a little bit versus having a large abdominal surgery to remove the fibroid with the
Dude,
risks
for
and things
real.
that come with it. Um, and I gotta say, like Soph told me this. Maybe you mentioned it at the end of a podcast and then we were texting about it. But I think I was just as shocked as you were probably in the clinic when they offered this as an
Yeah.
option because these things are all the rage right now. And in some
Mm-hmm.
ways for good reason because they're fairly effective. Um, however, just because something's effective at one thing doesn't necessarily mean it's going to be so great for the other. But when you come out with a medicine that a large portion of the population all of a sudden starts taking, we are going to, here's the keyword, observe things. We saw it
Mm-hmm.
with PCOS. A lot of people went on it for weight loss, and then all of a sudden they were surprisingly pregnant after years of infertility. Somebody was monitoring the size of the uterus and fibroids while they were taking this and realized that there was a reduction in size. Um, it's interesting that we observe these things, but then we have to study it. Is there going to be a huge amount of risk or harm for Soph to take this small level of this medication? There is some risk. There is some level of side effects she could experience.
Oh, and I've been freaking myself out about it. Let me tell you. I was like, I'm going to have dementia.
Because that is Sophia.
Muscle wasting.
But what I'm trying to say is like, these are individualized decisions you should make with a great practitioner that's willing to monitor you through it, walk you through it. This is kind of like stepping outside of what we do have evidence for, but maybe there's clinical evidence that just hasn't been published yet. And then by the time it gets published and then it makes it to practice. My point is sometimes the treatment seems a little outside of the 9 dots, but it still
Mm-hmm.
could be worth trying.
It could be. And I am not at all at the point where I would recommend this for anyone because I don't want to harm you,
Mhm.
but
We're just sharing your journey.
I'm just sharing what I'm doing. So I don't feel like as a practitioner that I know enough about this and am confident enough in its safety and efficacy to go tell the masses to go do this. But for my own sake, when it's my own self and I'm deciding what's right for me and I'm not influencing what's right for you, I feel more comfortable doing this. And I also know that I have done and am doing
Everything else.
freaking everything to try to get this going, to shrink this down, to prevent a tragedy like what has happened already from this thing. And so I am not encouraging anyone to go do this. You have to make this decision for yourself. You have to weigh the risks and benefits. And this is far more dangerous than diet, lifestyle, supplements, acupuncture, and body work. Far more. We're talking from here to the
Levels of
moon
magnitude.
distance.
Yeah. Mhm.
So I am certainly not going to say, go do this instead of those other things. I would say give those other things a good try. Like I'm talking 6 months to a year of a good try. And then consider this if they don't get you where you're trying to get. But this is not a first line approach at
No.
all.
But
But
people
I've
are gonna
done
be
first line, second
interested.
line, third line approaches, and here I still am.
Mhm. And people are gonna be so interested in how this works for you, and maybe this is like a whole new thing. Maybe it does
It could
nothing.
be.
We have yet to find out.
And the dose is so small. Like, okay, let's take a break for our third sponsor, and then when we come back, I can talk to you about how I've been feeling and like what I've noticed. 1 week on this medication and what I've observed so far.
We are gonna take a break from this episode and chat a little bit about one of our sponsors. Truth be told, when we were contacted by Fond to see if they could sponsor our Food Freedom Fertility podcast, it kind of was like one of those dream come true sponsorships. Let me explain why. There are very few foundational foods that cover broad nutrient needs for fertility, gut health, and baby's brain development like Fond is. And not only do they create these foundational foods, they kind of exceed in every category that I can think of what we want to put into our bodies. They're the only verified regenerative through land to market bone broth, tallow, and lard on the market. Unparalleled animal sourcing, all pasture raised or 100% grass fed and finished cattle. All the herbs and vegetables that are in the blends and the seasonings of these broths and lard are exclusively organic. Nothing is packaged in plastic. The entire packaging process is plastic free from kitchen to their shipping materials. When I think about this regenerative fat line that they've just introduced to the market, I use it in so many different ways. I've used their pork lard that's flavored with cinnamon and vanilla when I've been sauteing apples to put in my children's oatmeal. I've used their regenerative beef tallow that's flavored with chili and garlic as I've sauteed meat that's going to go into a slow cooked pho style dish. And then I've used their broth within that dish itself. I love the flavor combinations. I love that I can trust that these foods that I'm putting in my body are so clean but truly delicious. The infused flavors are ready to sip, and all the fun flavors can be used to take any dish from good to gourmet. I've been using these for the last 4 or 5 months every single day and have seen a huge difference in my own health. And I know this is our fertility podcast, but we started taking on Fond as a sponsor at the same exact time that my dad got diagnosed with esophageal cancer. And I had so much peace in these moments where he could hardly eat anything that he was sipping on a bone broth that had so much gelatin and collagen and amino acids that I knew we were reducing inflammation in his body and giving him just these beautiful, naturally occurring electrolytes and protein that was so easy to get down. This is one of my most favorite products I've ever used in my kitchen. And I am so proud that we get to partner with Fond. Fond has generously given us a coupon code for their website where you can receive 10% off. So that's FFF10. Or if you click on the link in our show notes, it actually brings you to a landing page where the discount is baked right in, and some of Sophia's and my favorite products are hanging out on that page for you to peruse. Please give this brand a try. Please support them. If you haven't listened to our episode, you are just gonna scream at how incredible this brand is and what they've come through, supporting a woman founded business that has your health and our planet's best interest at heart. It's something that I can't be more proud that we get to partner with, and they sponsor you getting this free fertility information straight to your phone every single week. Now back to our episode.
1 week solid, I've been on this drug. So this was my third dose that I had just now because I took the first one Thursday of last week. My second one was on Monday. And then this one I'm doing today because we're traveling tomorrow. And I don't think I'm going to bring these drugs with me. They have to be refrigerated, and we're going to be at a high altitude and such and so forth. So I think I'm just going to like take a week off, I guess. But so what I've been feeling, like first thing I felt was fear. So afraid of these drugs because Caitlin and I mean, we did quite a bit of research on these GLP-1s for good or for bad for our GLP-1 episode. And I always sort of am the canary in the coal mine. Like the reason I do home births, it's not for like some altruistic reason really, but because like I don't really respond that well to medications and stuff. Like I tend to be the one that gets the side effect or that like has the bad thing happen or like, a tiny little dose gives me all the problems. Just sensitive. I'm sort of a lightweight, even with like alcohol, like one drink and I could be hungover the next day. Like I just am sort of a tender gal when it comes to these things. So
You're
I
so
was
tender.
afraid. I'm so tender.
You're
I'm
so
just afraid
tender.
that like all the doom and gloom is going to happen to me. And like you just see the worst things happening sometimes, and some of it is like not even applicable. Like there are people that abuse these medications and they end up with gastroparesis and gut ischemia and osteopenia. There's people that maybe aren't abusing the medications, but they're certainly not doing the diet and lifestyle things to optimize these drugs. They start taking them and they're like, wow, I have no appetite. This is great. I'm just going to lose weight. And so they'll like have a Diet Coke for breakfast and then have some whatever their kids didn't eat for lunch and then just sort of like graze and munch a little bit for dinner. And that's it. And at the end of the day, they've met none of their protein goals, none of their fiber goals, none of their micronutrients. And they end up having a lot of issues because they're just not taking care of themselves, let alone doing the muscle building exercises that you need to do, let alone doing all like the supplements and everything. There's like a lot that goes into letting these drugs work well. And if you're not going to do those things, if you don't have a long history of being really on it when it comes to food and nutrition, I don't know that I would say to use these drugs. I really
Mm.
don't. Um, but that's what I've been doing. Obviously, nutrition and lifestyle is like my whole life. I'm not saying I'm perfect at it. I, eat chocolate chip cookies and sit on my butt watching Netflix just like anyone else sometimes. But I would say I'm definitely leaning into it a lot. And that is sort of the message I want you to take away from this is it's not one or the other. It's not, oh, let me take this drug or let me try diet and lifestyle and herbs and such. It's both.
Mhm.
And this drug that I'm using is really so that the diet and lifestyle stuff can work. I mean, that's my hope. Um, So the first thing I felt was really afraid that I'm going to have all these bad things happen to me. And after about a day or two, I was like, dude, I don't feel any different. My appetite isn't less. Maybe, I mean, if it is, it's like marginally. Like maybe my bowl of chili is like a tiny bit smaller than what I would have normally felt satisfied by or something like, but it's got to be really small. I haven't noticed like, "Oh, I didn't even feel like eating a snack before bed." Like, "Hell yeah, I still wanna eat a snack before bed." Like, who the hell doesn't? "Oh, I wasn't at all interested in those chocolate cookies." Like, "No, no, I'm interested. I am." But, so maybe there's been a small appetite reduction. I don't know that I've really observed that. I will say there's been a couple of low blood sugar incidents. And I say this in sort of a weird voice, making a weird face because
You're
they
prone
were
to
me
them
being
anyway.
so stupid. They were me being so stupid. Like, eating dinner at, like, 6 o'clock and then being like, "I'm not gonna eat a bedtime snack. I'm gonna give my gut rest, even though I'm hungry, but it's 10 p.m., so just go to sleep, don't eat anything." And then waking up at 6 in the morning and going and hitting a high intensity workout. And then what do you know? By the way, not only hitting a high intensity workout, mixing myo-inositol into a green tea, drinking that while doing the high intensity workout. What do you think happened to me, Caitlin,
Mhm.
after
Yeah, no
this?
kidding.
I had to lay on the floor of the gym like a child and wait for the nausea and dizziness to pass and kick
Mhm.
myself for not at least having like a mint or something in my purse. Such a doofus. So the only times I've had low blood sugars are things when I've done things that are like abjectly stupid, like what I just said. So there's been that. I have noticed like I wouldn't call it nausea, but I guess like
Like
there's
a
been a
tummy
more
unsettled.
yeah, like more times that like instead of feeling like, "Oh, I'm hungry," I feel almost like when you get so hungry you're to like the point of being like queasy? I sort of will feel that like, "Okay, I need to eat." Like I'm almost getting a little like, ugh, from not eating. But it's not I guess when I think of nausea, I think of like what I felt when I was pregnant, which is like almost like I just stepped off the spinning carnival ride, like seasick feeling. And this has been in no way like that. This is just more, yeah, like you said, like sort of like tummy unsettled or like instead of being hungry and having like a craving for something, because usually when I feel hungry, this is how I experience hunger is it's not like I feel hunger in my belly. It's more like a food thought happens where I'm
Mhm.
like, oh, buffalo wings. And then I'm like, "Oh, yeah, that would be good. That would be good. Buffalo wings." And then I'm like, "Oh, I'm hungry. I need to get some food." But, like,
Mhm.
usually that's how I experience hunger, and instead, it's been more like the physical hunger will happen first, and then I'll be like, "Oh, I should eat. What do I want? Buffalo wings." Like,
Mhm.
it's been a little bit reversed,
Mhm.
but, that's sort of been the negative side of what I've experienced.
No
The positive
diarrhea,
side
no constipation.
0 diarrhea, 0 constipation. This is what's been shocking. My digestion has been better than it has been in since I can remember.
Hmm.
Like the bloating, every night I go to bed with like a pregnant looking belly, like this swollen, big, tender belly. I'm the person that can like button my jeans in the morning and then like cannot fit them around me by the evening. Like
Mhm.
I'm in the stretchy pants by
Mhm.
bedtime. Or just a dress or
I
something that
like
I
that
can't
club.
tolerate. What was that?
I like that club, the stretch your pants at bedtime club. Maybe not for that reason, but I like that club.
Yes, but, like, by dinner time, let's say, like, I
Okay.
am like, "Oh my god," like, I'm in pain from this waistband, and they were loose on me this morning. So, this has always been my plight, and I have n the past couple days, this has not happened at
Hmm.
all, which has been so surprising, and, like, I touch my belly. It isn't like this tender, swollen, achy thing. It feels touch my belly, it's like touch my breast, touch my leg, like, it just feels
Like
w
tissue?
y like tissue. It's not like this deep ache that
Not
goes like up into my
inflamed.
ribs and into my
Mhm.
back, almost like this sensitive thing. So I've been looking into that a little bit, and turns out that these GLP-1s can actually really help people with mast cell activation,
Mm.
which I'm wondering is potentially a part of what's been going on with me. I don't know. I'm doing the GI map. I just sent in my stool sample yesterday. So while we're on our trip, we'll get some results about like what's happening in my digestive system. But so I don't know. I just feel good. Like
Yay.
I don't feel low energy. I don't feel bloated or constipated or like my belly hurts all the live long day. I just feel normal. And like if you I don't it's been 1 week. I highly doubt I have lost any weight at all. Maybe half a pound or something, like at most. But if you just look at my belly, like it is so much less swollen.
That's
It's like just
exciting.
not bloated and puffy. It's just normal. So,
I think a lot of people who may be on a GLP-1 receptor agonist is hearing something that they're feeling, but maybe mirrored in a different way. Like their normal is like, oh, this is how people probably feel about hunger and food, like the food noise that people talk about. And
mhm,
I think that this is a really powerful kind of reckoning people go through when they get on a medication and they realize something was wrong and this medication is helping me fix X, Y, or Z. Maybe it's your anxiety. Maybe it's depression. Maybe it's blood sugar levels. Maybe it's something where your body is struggling, albeit maybe it enhanced a struggle because of nutrition, lifestyle, or whatever, but your body is struggling, and then you come on to something that's like life changing and you realize like most people don't struggle with this thing that I just felt was a character flaw of my own, or
mhm,
this thing I was just going to have to deal with the rest of my life. And often I think people are approaching us and thinking we're always going to be like nutrition first or not open to some of these more interventional options, like medically
mhm,
interventional. And I think that there can be like a beautiful in between where you find what's right for you. And Soph is a week into this. Who knows what she's going to feel like 4 weeks from now, 8 weeks from now, 12 weeks from now, a year from now. Like who knows?
mhm.
Um,
Yeah,
this
it's
is
true.
this also comes with a price at the moment, right? Like we know you're
It
not supposed to actively try to conceive while
it
you're on it.
does. We basically had to sign in blood that we were going to use heroic measures to prevent pregnancy. I'm not willing to go on a hormonal contraceptive. So basically, it's like you will use a condom the whole time, every time. Pinky promise. Like they were really like, you cannot become pregnant on this. And listen, I've Caitlin and I both have known people who have gotten pregnant on this. And I have not seen anyone, have a third arm growing out their ass or like any crazy weird
That
thing
would be called a
happening to their
tail.
baby. A prehensile tail. No, I haven't seen,
Yeah,
catastrophic disabilities in children or pregnancies going horribly awry or like
it's frankly too
I
early
haven't
for us to
seen
know
anything like
those
that.
things.
It is too
Like
early for us to know those things, but it is just one of those meds that they're like, do not get pregnant while you're on this. So, yeah, we're taking a hard pause on trying to conceive right now. And I, that was another difficult decision to use this med. Like, God, isn't that hard? Like, to stop trying because
when you want to be
now you
trying.
know for sure that it's gonna take even longer to have a baby? Crap on a spatula, like, I don't wanna do that. I don't wanna do that. Here's what I want, guys,
Crap
okay?
on
I
the
want what you
spatula.
want. I
What does that
I don't
even
want
mean?
what I'm imagining is, like,
somebody flipping doo-doo on a pancake griddle or like don't go poop in a toilet, aim for the spatula. What are you even
Dude, I feel like that's
saying?
what I had to do with the GI map. Have you done that yet?
Yeah, that's not a spatula, that's like a
It's
french
like a
fry
french fry
container.
tray. It's like what they hand you a corn dog on at the fair. Oh, it was disgusting. I have changed hundreds, thousands of poopy diapers. And it was not like this. This was horrible. So, oh, yeah. Well, anyway, crap. I don't want to prevent pregnancy. I don't want to deliberately press pause on this. What I want is what you want. I want to get pregnant easily, have stress free, easy pregnancies, births that feel like a sneeze, and no problems ever again in my life. This is what I want. I don't want to do all this shit. I don't want to try to conceive. I don't want to work on my health. I don't want to shoot drugs into my belly fat. I don't want to do any of this. No. But that's not my life. So I had a mild tantrum where I was like, this sucks. Screw this. I don't want to do it. No, no, no. Why me? Poo on you. And then I was like, all right, well,
We're done
it's
with
not my
that?
fault, but it is my problem.
Mhm.
If I don't do anything about this, nothing is going to get done.
Such a good
So,
sentence. It's not my fault, but it is my problem.
yeah, I mean, that welcome to fertility struggles. It's
Yeah.
not your fault, but it is your problem. Like, if you don't do something, no one's going to. I mean, maybe a miracle from God,
Mhm.
but even in every miraculous situation I read in the Bible, it's people that have done, preparing of their hearts and making of the way and have a very submissive and humble attitude towards God and say, Lord, send me. And not, no, I'm going to sit here and you just do it, which is
Mhm.
essentially my attitude. So, uh, anyway, I don't want to do any of this, but I have to. I have to do something. And I gotta say, this is fun. And I'm sort of turning a corner on my Instagram right now. For so long, I was like, oh, we must do what the algorithm pleases. And I have to use like trending audios and I have to do all this stuff and I have to make it be what people want to see. But now I'm like, no, I'll probably still do some of that because it is fun to make reels. And sometimes I get a good idea that I think is going to be really funny. And I just like to do that. But I'm going to be like, hey, who here is wondering if Inito works? Let's try it. Hey, have you ever, has your doctor told you about the GI map or have you learned about this? I'm going to do it. Let's see what it does. Who here wants to know what an MRI of your uterus looks like and feels like? Let's go. So I'm in a very unique position of privilege. Maybe privilege isn't the right word. Advantage maybe would be the right word.
Probably both
Whether,
to some degree,
yeah,
honestly. I
yeah. I
mean,
mean,
not
I've
everybody
worked
can
hard.
afford to put terzepatide into their belly.
Well, and here I don't even really have to because Joy Wellness Partners is like, hey, if you're doing this, and this is sort of like an experimental thing that you're showing people on Instagram about, we'll support you in that.
Oh,
And
that's
so
cool.
I've got a contract going with them. They supply the meds and a bunch of other stuff. Like they're like giving me all kinds of treatments. Like have you been hearing about the nicotinamide dinucleotide what the hell is that stuff called? NAD.
Mhm.
NAD infusions for ovarian health. Well, guess what? That's a part of this package. So I'm going to go do some of those and we're going to see how it feels and what it does. And we're going to do another MRI to look at my fibroid and my ovaries. And we're going to look, what is this stuff doing to me? So that you, listener, don't have to say, gosh, I got to buy another thing for another thing. And meanwhile, another cycle's going by. And I don't know if this is going to make me better or worse or do nothing and stress me out for no reason. Is this even worth it? And realize we have a study sample of one because it's just me doing this. But if you wished You could, split your reality and go try something and just see how it does, and then come back having wasted no time at all and have none of the side effects. That's what I'm giving you. I'm
Mhm.
essentially experimenting on myself
You're the guinea
during
pig.
these next 3 to 6 months where I have to avoid pregnancy anyway. We're just going to try it.
Do
We're
it
trying it
all.
all.
Well, if you heard the beginning of this episode and we said we were doing a two-parter, joke's on you. But joke's on us, maybe, that we think we can cover two topics in one day. Huh. Our podcast episodes are always over an hour, and we hardly cover one topic in one day. So we're going to leave you here. Put a bookmark in it. We will record an episode on all the research that I've done lately and clinical kind of experience in watching Clomid and Letrozole in different PCOS cycles with clients. And we're going to just put a button on this episode. Hey, friends, we're taking a break from our episode to talk about one of our sponsors. And this sponsor is the PCOS app. Did you know that I made an app all about PCOS? Well, I did, and you can find so many resources in it. We have slowly moved all the resources from my PCOS Hormone Academy course over into the PCOS app, and that talks about all things PCOS topically. Like if you have acne, you can go look at the skin and acne modules and see, what does Western medicine offer? Why does this impact PCOS? What can we do about it? What are natural remedies? What are nutritional remedies? We talk about hair loss and hirsutism all through that lens where we go through, what is it? Why is it impacted by PCOS? Or why do we need to pay more attention to this particular thing? And what can we do about it? And we provide a vast resource to help you both advocate for yourself at the doctor's office and treat yourself at home naturally. Now, the exciting thing that I want to share with you is starting in January 2025, we're starting to migrate all of the content that I have published so far on fertility into this app. I used to sell a course for $700 all about how to get pregnant with PCOS, and that is all getting moved into the app between January and March. So you can take the course as if you enrolled in the whole thing for $10 per month. So head to your app store, whether you're on a Google Android device or an Apple device. If you type in PCOS app, you just look for that really pretty lavender flower, you'll find it. Download it and join us because you're going to get weekly recipes and all the fertility focused PCOS content that you need. It will start being uploaded under the Academy tab. So stay tuned for that. And let's get back to our episode. So let's
Mhm.
girl it up. I have a few at the tip of my tongue. Do you want to go
My
first or
biggest
should I?
girl, you already revealed. Tomorrow night, I will be playing pitch with Caitlin in Vail,
Have
Colorado.
you played Ecologies yet with the Star Gang?
I have no
Okay,
idea what that is. No, I have not.
I'm bringing it, and that's the other thing you're going to learn this time. It's going to be your new favorite game. It's going to be
I'm
amazing.
so excited. I don't usually like to play a lot of games, but I had so much fun playing cards with BJ's family last year, and I'm
Mhm.
pumped to do it again.
It's going to be so fun. We're bringing lots of games. I'm bringing Pie Face for the kids to play
Stop.
whipped cream on their face. On my Walmart order at the top of the hill, I have 3 whipped cream bottles so that we can play it
Oh
every
my
day if we want. It's gonna be so fun. Okay, I have a huge girl. I haven't
god. Okay,
even
I can't
updated
wait.
my dad's carrying bridge yet, but we went to the follow-up appointment with his cancer surgeon yesterday who took out part of his esophagus and reconnected things with his stomach and reorganized, reshaped. He's been on tube feed. He's going to continue on tube feed for a while longer, but we're getting to progress his diet and he's going to what we would call nocturnal feeds. Basically, we're just feeding him overnight so he'll have some hunger during the day and he won't be attached to a tube during the day. So, like, we're making lots of progress. But we were all patiently awaiting this appointment because nobody would call and give us pathology over the phone to hear, did they feel like they got it all when they took out
Were
part of
the
my dad's
margins
esophagus?
clear?
Yeah. So they want clear margins on either side. They took out a third of my dad's esophagus and 14 or 17 lymph nodes came along with it. They found
Holy
about
moly.
half a centimeter worth of cancer kind of at the original site of the tumor, which was huge. So it shrunk and died, essentially, most of it based on the chemo and radiation. And then they
You hear that,
found
fibroid? That's what we're aiming for here.
we're going to kill you. And two of the lymph nodes had like minuscule amount, which they think they got it all. We're going to probably do a little bit of immunotherapy once we're totally recovered from the surgery to just increase the odds of it not coming back. But it was like pretty much the best news we could have gotten. I mean, it would have been
I'm
wonderful to
so
hear
relieved.
they couldn't find any and they took, that might have made him go, should I have done the surgery? But it took us a lot to get to the point of, do we do this crazy life-changing surgery at 74 or not? And it was just also just a very interesting period of like working, helping to advocate for someone, walking the path with them and allowing them to like lead the road in terms of what they want to do and being okay with it. And I have a lot of practice at that, right? Like I'm not the one making the nutrition changes or having the reproductive endocrinology appointments. And I coach people through those things. I try to
Mhm.
equip them. I help them have questions to ask and yada yada. I did that a lot over the last 6 months. But this was like a major something. And I remember sitting in my parents' room about 2.5 weeks before the surgery, and he was really waffling and leaning more towards not doing it. My mom just turned to me and said, "Well, what do you think?" And I was like, "Are you sure you want to hear what I think? Like, I don't want to sway you guys." And they were both like, "Yeah." I was like, I know you need to do the surgery, and it's going to take you a while to maybe come to terms with that. But surgery is the next step. We shouldn't reschedule, like yada, yada, yada. And um, it was an interesting time in my own just like walk with God to be very confident in something and just knowing like wait for the right time to bring it up, wait for, and be supportive if he decides I don't want to do that. And if that
Mhm.
means I die of cancer, I die of cancer. Anyway, it's been a very transformative, hard, but wonderful time for all of us, and just drawing close to God and being a family and loving each other and being there for each other. And we got really good news yesterday. It sounds like we really are kind of on like a downhill ride at this point versus climbing a huge mountain in front of
Mhm.
us.
Mhm.
And so that's all really positive, and he can actually start eating something other than liquid now. So
Oh, cool.
things are
Oh,
good.
yeah, girl. Yeah, Pat.
Yeah. I know so
Oh,
many
I
of you
love it.
listeners have prayed for him and for me and for us. And it's a really interesting, yeah, girl, us going to Colorado tomorrow, because while we were there last year, Sophie's dad got a throat
Yeah,
cancer
he got
diagnosis
diagnosed while we were there.
literally while we were there. And my
And
dad
he was
halfway
also
through the
there,
year.
which is crazy.
Yes. Yes. And then my dad halfway through the year got this diagnosis. We both have walked this road with our parents, and we're going back almost a year. It's like 2 weeks shy of a year to the day that we were there last
Mhm.
year, and they're both on the other side of it. It's so incredible. I just
Surreal
can only
and
praise
wonderful.
God. Yeah.
Yeah, and my dad will be there this year too, and it's just so awesome. This is going to be really good. So that's the yeah. I mean, I'll take that as my yeah girl too. This
Yeah.
is yeah girl day. Love it.
Mhm.
So
Mhm.
happy.
And you know what? I have a 5-minute break between this, and I get to go meet with a client who's like, "Can I book? Because I'm pregnant now. What?" And I was like, "Those are the best appointments."
Oh,
Like,
100%.
let's just
Love
talk
those.
about how to manage morning sickness and like how to navigate advocating for yourself in this pregnancy. Here for it.
How to not freak out. Oh my God, can I eat grapes? Can I eat pineapple? Is it safe to eat seeds? How to just enjoy
Just
yourself.
yes, it's gonna be so good. So we'll be here next week, guys. Like, rate, review, subscribe, send this episode to a friend. Thanks for being a part of our community, and we'll see you next
Thank
time.
you. Bye.